Healthcare issues, of course, are at the top of the agenda for many in North Carolina, and one of the groups that's focusing on policies in the state is the Foundation for Government Accountability. Joining us now to talk about some of the big issues in healthcare is Josh Archambault. He is Senior Fellow at FGA. Thanks for joining us.
Thanks so much for having me, Mitch.
One of the things that you have been working on is increasing this option of direct healthcare. First of all, before we talk about what can be done, remind us, how is that different from the traditional setup that we're all used to?
Sure. So for most people who have employer-based insurance, let's say, they go to the doctor and the doctor gets paid for each of those visits. And then they wait. And then they wait, and then they get something in the mail, and they get very nervous because it's from their health insurance company, and maybe they owe a $30 copay, or actually maybe they owe the entire visit. It's really a crapshoot on what's going to show up in the mail. And what it really is driven by is what insurance plan that you are on. And depending on your deductible level and your cost sharing, it really is very different for different people, and you don't find out usually 30 to 60 days later. So that has led to all sorts of problems in healthcare. But moving in this direction of direct health care, it's really you make a contract with an individual provider or a group and you pay them a monthly fee. It's very transparent. You pay them, and there's all sorts of benefits that can come of this model that we can talk about. But the main thing is certainty. There's no surprise bills. There's no big bills. You're not waiting. You know what it's going to cost every month or for the entire year.
And because of that, you also know what you're paying. It isn't something where, I kind of think I'm paying this, but I'm not really sure. You know what the bill is.
Correct. Yeah, and probably the most familiar that people may be with direct healthcare arrangement is direct primary care. So primary care providers, and usually the fees there are somewhere roughly around $50 to $100 a month, depending on how large your family size is or what the practice offers. But again, very transparent. You know exactly what you're paying for up front.
What are you working on that front in North Carolina?
Yeah, so, there are direct primary care providers here in North Carolina, and perhaps some of your listeners use those, and they can see the value. But really, primary care doesn't need to be limited here for the direct arrangement. There's an opportunity here, whether it's a physical therapist, whether it's for mental health procedures, anything in which an ongoing relationship with a specialist, the direct healthcare arrangement would be beneficial. So we're trying to make sure that the state law allows for and clearly says, and this is the technical piece, this is not insurance, because there's not a transfer of risk. It's not like a health insurance company. It's just saying we need to have a contract, be very specific about what's included in it, but have all of those benefits that people may be familiar with direct primary care, and John Locke has written about so great in the past, extended into specialty care.
We're speaking with Josh Archambault, who is Senior Fellow at the Foundation for Government Accountability. Tied into this in some respects is something that is sometimes called telemedicine or telehealth. What are you working on that front?
Yeah, it actually ties in very nicely because a lot of direct primary care doctors use telehealth currently as a way to increase access for people to be able to be in contact with their provider without always having to come into the office. So there is in an age of coronavirus and other concerns, telehealth has really been pushed to the forefront. And North Carolina doesn't have a lot on the books when it comes to telehealth. There's not even a formal definition of what it is. Now, the legislature has passed a bill. Both chambers have passed a bill, and they're in a conference committee. But there's some opportunities here. And one of the primary opportunities is to make sure that people can use telehealth across state lines. So we can think of a number of situations where practically this would be helpful. Know a parent moves home with you. They're retired or they have some health needs, they move home. Well, if they lived in another state and had providers there that know them well, know their health needs, have a long-term relationship, they're currently not allowed to continue to see your parents unless they have a North Carolina medical license. And so we want to say, if that provider knows this patient well, if they are in good standing in their home state, then they should be able to continue to see that patient through telehealth. Not for all of their healthcare needs, but for where it's appropriate. And so we want to make sure that we have a more flexible healthcare system to increase access in rural communities where there are simply not enough providers. So maybe somebody has diabetes, endocrinologists, there's not a lot of them. So maybe this is an opportunity for somebody to connect with an endocrinologist who lives 50 miles away or 3,000 miles away. Maybe they can be a good person for them to help better manage their diabetes, which is going to help the patient and help that person's family in the long term.
We've touched on this a bit already, but one of the issues that's tied to these types of innovations is this idea of increasing medical price transparency. What are you working on that front?
Yeah, I think there's been a lot of conversation about this. There's some new federal rules that the Trump administration has put forward, both for hospitals and insurance companies. But, states play a big role in this too, making sure that they pass laws that say that individuals should be able to see what the real price is ahead of time.
Shocker.
I know. It's really, in any other area of our industry, in industries, we expect this. You don't go to the grocery store and don't see prices. You actually want to know what the price is going to be. And so a number of states have passed laws, and we'd encourage North Carolina to step forward in this regard as well and say that patients ahead of time should be able to see the real prices that their insurance company, if they're insured, is going to pay. If they're uninsured, what the cash price will be, and they should be able to compare between providers so they can choose. And just to put a fine point on this, the price differences between parking your car in different parking spaces can be tens of thousands of dollars for the exact same procedure or service. I think it seems only fair, as people are anxious about medical debt and bills, that we let them know what something's going to cost ahead of time.
There are a lot of different ideas that are floating about in the healthcare reform world. As you work in North Carolina, are you hearing a lot of receptiveness to this? I mean, is this the type of thing where you meet with legislators and policymakers and they say, yeah, this is something we should look at, or are many of these ideas ending up in the circular file?
I think there's a ton of interest because as these legislators are going back home for Chamber of Commerce, breakfasts or lunches, this is the number one issue that they're hearing about. It's healthcare, healthcare, healthcare all day long. And so I think everybody recognizes, even if they disagree on perhaps some of the policy solutions to get there, we need reform. And so there's been a lot of interest, and maybe it's just a question of timing more than anything else, or how far the legislature feels like they're able to go in one session versus the next. But we're very optimistic about the reception that we have heard from legislators of, we understand there's a problem on high healthcare costs, and I actually want to do what's right for my constituents on this issue.
We've touched on several different things. As you get ready for the General Assembly coming back, or thinking ahead to what might not get done this year, but what to look forward to in the next session after 2021, what are the top priorities? What's number one or number one and number two on your list for North Carolina to do?
Yeah, I think we've talked about some of them today. It's really reducing uncertainty for patients. As we've done lots of survey work and focus groups, this is where the American public is. They want more certainty going forward. So that certainly gets to price transparency, and that certainly gets to the direct healthcare issue that we talked about. I think the other one is access or options. Are we able as patients to be able to see the right provider at the right time? And that gets into some of the issues around telehealth, making sure that if your family member gets sick with coronavirus and the expert for coronavirus is next door in the state next door, that you have a way to be able to touch base with them through telemedicine instead of having it be illegal for them to see you as a patient because they don't have a license here.